associated with the remarks, I think, expressed by most, if not all, members here today in terms of the sympathies that were expressed to you, Gerald, on the loss of your sister, and indeed my sympathies to Senator Paul Coughlin as well in terms of the loss of his mother. I've organised a briefing, as was referenced by Senator Conway Walsh and Senator Éireann today. I want to thank them for attending a briefing with the SIP2 Health Division to explain to TDs, senators and staff in these houses why 10,000 members of the SIP2 Health Division decided to take industrial action commencing this Thursday. Because I think it's important that members of this House understand why that difficult decision was taken. And it was not a decision that was taken in any way lightly. A number of years ago, the government decided, in consultation with the trade union involved, to undertake a job evaluation process, an investigation and examination into pay rates, skill sets, and how the roles of healthcare assistants, porters, surgical instrument workers, technicians and so on has actually evolved over the years. And that independent job evaluation process showed a number of very, very interesting things. It showed that those particular jobs evolved to the point where skill sets are enormous now, the requirements of those jobs are enormous, the responsibilities are enormous, and critically that those workers, 10,000 of them, are in fact significantly in many cases underpaid. But unfortunately this government has decided not to fulfil its part of the bargain. It has accepted the outcome of that process, but has in essence shelved the reports involved and refused to pay the monies owed to our healthcare assistants, to our porters, to our hospital chefs and other important health service support staff grades on which the health service depends. The first person we meet when we go into a hospital is the hospital porter. We're very much dependent, those of us who may have had stays in hospital, on the work of our healthcare assistants to support nursing staff and the medical staff. They do enormously important jobs, but unfortunately this government doesn't seem to recognise that. There is, in essence, an upstairs-downstairs relationship, as described by my colleague Paul Bell from SIP2 earlier on today. This government certainly seems to value the work that's done by doctors and nurses, and we all do, but doesn't place any value whatsoever, in accordance at least with the attitude of this government in terms of this dispute, on the work done by healthcare assistants and others. Critical cogs, making sure that our system works and works effectively and efficiently. And I'm sick and tired being told by Fine Gael ministers and deputies and senators that this and matters like this are actually a matter for the Labour Court. This is actually a political issue. There's no discussion to be had in the Labour Court because the evidence is actually based in these job evaluation reports. The government has accepted the job evaluation reports. It's now a political decision as to whether or not Minister Donoghue will pay the monies to the Department of Health and the HSE to ensure that these people get the recognition that's due to them, get the respect that's due to them and the monies that are owed. So this is a political decision and I'm calling on members of this House to support the SIP2 workers who will be on strike on Thursday. That's the first day of industrial action, the first of 5 that are planned. I hope it doesn't get to the stage where we have other days of industrial action, but that is a matter for the government, a matter for the government to address now.